do now is actually introduce you to 3 people who are doing some of these roles, and they may be jobs that aren't quite as well known. You may not have heard of them before. I have to confess, I didn't know what a peer support worker was until very recently. So we're going to hear a little bit more about that. Our 3 friends have kindly taken time out of their very busy days to share a little bit more about themselves, the jobs that they do, how they got into those jobs, what they really love about them, maybe some of the things they don't love quite so much. And so I'm not going to steal the show. I'm going to stop talking because these guys really are the stars of this session. We'll show you, as Julia said, some video introductions to them first, and then I'm going to come back and I'm going to ask them lots and lots and lots of questions about what they do. So without further ado, I'd like to introduce you to Lauren Armstrong, who's a care worker at Abcross Nursing Home, Michael Winspear, who's a peer support worker at North East London Foundation Trust, NELFT, and Habiba Ali, who's a community neighbourhood link worker at the London Borough of Newham. The event, but would you like to just spend a couple of minutes introducing yourself and what you do?
Yeah, no, that's fine.
Thanks,
hi,
Lauren.
I'm Lauren. I work at Abcross Nursing Home, and in the nursing home we help vulnerable people who are unable to help themselves, that they need help to do everyday activities, things that we take for granted, and that we want to be able to supply them and help them with everyday activities. An everyday activity in the home is personal care, sitting with them, talking to them, doing things that literally we do take for granted every day. I would say a day to day at Abcross is obviously getting them washed, giving them baths, showers, bed baths if they need them, changing pads, all different things. So yeah, I don't know what else. What would you like?
No, that's great. Thanks, Lauren. I think if we just get you all to introduce yourselves first, and then I've got a whole bunch of questions that I can ask you, if you don't mind. I'm a very, very nosy person. Michael, would you like to go next to tell us a little bit about yourself, what you do and how you got into your role?
Hi, my name's Michael Winspear. I work for a project called Coping Through Football, but we do another one called Football for Health for children from the ages of, I'd say, 10 to 17. I got into the project because I suffered with anxiety about 12, 13 years ago. And what happened is I started going to the project, but ended up down the line 5 years now. I've been working for them because they needed a peer worker on board. This project is run by the National Health Service, but we have links with London Playing Fields, and we have the coaches who come to the sessions from Leyton Orient. Also, we're lucky enough to have a little friend on board called Mr. Harry Kane. So he provides us with a little bit of kit now and again and some football, and the parents come over and visit us. So basically it's like it's a nice little little thing going on with them. My main job is to try and move people through football to get their exercise, to move them on to get into voluntary work or even into jobs. Preferably, I'd say it's voluntary, and then getting them into jobs, because as we all know, if you haven't been working for a long time, going into work is just a bit of a shock to the system. So that's the best route. As for kids, try and get them into like other sporting things, or if they want to join other little clubs or other sports. That's the main objective. But it's a matter of just getting people out of their house and getting them fit and on the road to recovery. Challenges, well, a lot of them, as we all know, don't take their medication and say they are, but they're not. So there's a lot of confusion, because some of them turn up and they a bit funny with us. So we like, are you taking medication? And they say, yeah, no, you know. So yeah, that's about it really. I have to admit, I enjoy working with the kids more, because I feel like if you can stop it when they're younger, then they're not going to go into that adult sort of scenario.
Yeah, agreed. Thanks, Michael. That's really helpful. Actually, somebody's written into the chat, perhaps we can bring Harry to the next careers event. Use your contacts from your little black book. That's lovely. It's great insight. Thank you very much. Now, Habiba, over to you. Can you tell us a little bit more about what a community neighbourhood link worker is and how you got into it and what you love about your job?
So good morning, everyone. Wow, so my job title is very long, so every time I'm going around introducing myself, everyone's like, so what is that? So community neighbourhood link worker. So we've got community, which is one of the sort of important element of my job, and then we've got link worker. So the linking part is actually linking our residents to adult social care, making sure that they get the support that they need. So with my lovely project, we work with adults that are vulnerable and isolated. So again, for many people out there, I'm sure we've all gone through loneliness and feeling isolated and lonely, especially during the pandemic. And I think many of us sort of pre-COVID didn't really understand what loneliness means, but having to be isolated within our own homes, I think many of us experience what a lot of elderly people go through, what a lot of disabled people go through. So this is the job that I do, which is to try and support people to ensure that they get the correct support. So a lot of signposting. So if we have someone signpost an elderly person who doesn't have family, who lives alone at home, but actually wants to start making a few changes in their life. So I will try and sort of support them and see what's around in their local area. So it might be a coffee morning at the library. So my intervention will be to go and assess this person at home. And again, because of COVID, unfortunately, we've now not been allowed to do that. So we're doing this all over the phone. So it's about getting to know that individual person, finding what their interests are, what the things that they don't like, about their health. So assessing all of those and understanding what their medical conditions are, what their family background is, and then trying to sort of, match them up to what's available for them. And again, very interesting, during COVID, libraries were closed down, you had community centres closed down, so a lot of people were stuck indoors and they had nothing going for them, which obviously meant they got even more depressed and their medical conditions got even worse than from what it already was. So a lot of services started creating befriending services. So we started signposting people to actually have someone call the elderly person up and just, find out how their day is going, if they need any help with, dropping off food parcels to them. So with our job, there's so much, and it's a really exciting job, because I will always say every day is going to be a very different day. You'll speak to so many different people, and something you'll see in the video. I love talking, and part of this job is, if you're someone who is sociable, who likes to have a chat, you'll love it, because you'll have someone telling their story, their walk of life. You'll have an 80-year-old person who's telling you, how it was back in the days, and it's really nice. But again, we work with anyone who's an adult, so that will be 18 plus onwards. We'll have people from, with different disabilities, different difficulties. You'll have someone with mental health, someone with physical difficulties. So, you're working with so many different people. One of the questions was what I love about this job. Wow, it's meeting different people, having the opportunity to make a difference in someone's life. And we all do this when we have friends and our friends having a bad day. We want to be there for them and we want to advise them and guide them, and that's exactly what I'm doing, but I get paid for it, so that's not bad. But it's a really, really lovely job. I work for the council in the adult social care department, so you're working with occupational therapists, you're working with social workers, you're signposting to GPs, again, dentists. We even work with pharmacies, because you have a lot of elderly people who will turn up to the pharmacy and who would want to have a basic chat, and that's really important. So hopefully the staff there will understand, hold on, this person seems quite lonely, and they're always coming in to come and have a conversation, so they might need some help. So that's where that pharmacist might actually come to us and be like, X, Y, and Z actually might need a bit of support. So I'll pick that up, I'll contact them, and then I'll go through what support we can give them. And they've got 6 weeks to to have our support, and hopefully, you know, we can make those changes in their life. So yeah, there's lots happening, and hopefully I can have more questions thrown at me later on, and we can get, you know, into a bit more detail about that. But yeah, I am really glad to be here and share what I do, because I think it's really special and unique in terms of what I do and the project that I'm doing. So hi all.
Yeah, thanks, Habiba. That was a really heartfelt sort of introduction to your job. And I think what's really interesting is that the pandemic has thrown so many challenges at us all, but what it has also done, it's shown how our community has bonded and really got together. And you talk about befriending, you know, and people have been able to volunteer, haven't they, to go and check on neighbours or drop food parcels and things like that. So I think that's sort of become part of our ethos now, which is lovely. And volunteering is such a good way, I guess, to sort of move into roles such as yourselves. Anyway, so I do have a few questions. As we've said, any of our audience that like to ask anything of Michael, Lauren and Habiba, stick it in the chat and we'll get those questions asked. But for me, Lauren, I'm going to come back to you if that's all right. And I have had the advantage and the luxury of watching your video in advance. And one of the things I found really interesting was that like Michael, you're a fellow sport lover, and you actually started off at uni doing sports, if I'm right, and really loved dance. So I'm quite interested in how you went from the sports and the dance thing to following your sort of path, your career path into care and care work. Can you take us on that little journey, please?
Yeah, of course. So yeah, like you said, I started off at uni in 2019. Sorry about that, the dogs. Doing sports science. I had danced for 16 years. I'd done all sorts of sports and was really interested in that. And I said from the age of about 5 that I'm going to be a PE teacher. That's all I ever wanted to do. It got to uni and I didn't enjoy the course as much as I thought. And that's when the pandemic came in, and it made me change my view of the world and what I wanted to do. Because I was just going to stick it out and then see if it was better when it came to it. And so when the pandemic hit, obviously the job offer came up of the care assistant and they needed support. So I came on as bank staff, so that because they thought, oh, we can use you as extra staff if ever anyone goes off with COVID. Well, them sort of hours, I started off doing 12, 18 hours a week, then turned to 30, then turned to even more from that. So in the end, they took me on as a full-time staff, still working there now, obviously, to this day. So that's over a year and a half on. And it just meant that I was able to get more hands-on in the pandemic and I was able to make a difference to people's lives.
Yeah, thanks, Lauren. And so many people haven't they, contributed so much more during the pandemic, and I guess identified skills that they had that they didn't know before, you know, the pandemic started. Thanks, Lauren. Michael, coming to you. You say you've been doing your job for like the last 5 years, time before that. What jobs had you held before?
Jobs before, I worked up the city for 6 years. I got made redundant. Worked in B&Q. Where else did I work? Worked in a couple of pubs, and then that was about it. And then unfortunately, I started getting anxious about things and ended up starting jobs and leaving them. Then what happened is I found this advert in my local Guardian about coping through football and started doing that. And then I went on to do my football badges as well. So they paid for that, and they still do that through coping through football. They pay for people to do their FA badges, to get their coaching badges.
Oh, I see. So that's kind of that's on the job training for you, getting these badges, is it? And
yeah.
Oh, how interesting. And so were there any particular skills you developed during the banking days, the pub days, etc., that you found have really helped you in the job that you're doing currently?
To be sociable. I've always been sociable. The thing about the job I do as well now, being a peer is that you've been there and seen it and done it and got the postcard. If you understand what I mean by that, is that if you've suffered with mental health, you can relate to people that are going through it as well. So you can turn around and say, oh, you don't want to do that job yet. Just take a back step and look at other things to do beforehand, and then you try and say, why didn't you do a 6-week course training or something in anything that you want to do, like peer working or something else like what these two guys are doing today, instead of putting yourself through the rigmarole of starting a job and thinking that's too much for me.
Actually, Hannah's just put in the chat, it's amazing that you've used your own life experience to help others. So thanks for that, and thanks for being honest about it. That's great. Habiba, you also, again, I've watched your video, you also started studying something quite different to what you're doing, art and business, I understand, and then spent a bit of time at the London Overground in HR, and then volunteered as a befriender, which obviously you've spoken a little bit about. What made you change your sort of career ambitions, changing what you studied to what you do now? And also, what advice do you have for students that are listening about how to get into volunteering opportunities?
So yeah, I mean, hopefully the video will be passed around, but I always had an interest to start my own business. My father, again, from a very young age, he's owned Indian restaurants. So I guess growing up in that sort of, background, I always aspired to have my own business, have people working for me and everything. So I did study and sort of graduated with human resource management with business studies. So there was also an element that I was interested in, sort of HR and working and sort of helping people with their employment. But I guess when I started working for London Overground, it just became a 9-to-5 job for me, and I was like, okay, it's just I'm here and I'm getting paid and I'm doing a job. But when I used to sort of leave the office, and I always sort of felt this element that I really wanted to do something different. And I guess part of my personality, I love helping people. Like, you'll have a stranger there, an elderly person who can't get on the bus, and I'll sort of run up to them and help them and assist them to get on the bus. So I guess from that, just very randomly, I saw an advert in becoming a befriender, and I never knew what a befriender is, and I was like, what is that? And it was through Islington Mind. So I actually did a bit of research, and I got to sort of find out a bit more in terms of what to do and, what the sort of volunteering role entails. And it's helping someone who's recovering from schizophrenia, and it's about going to support them to achieve their goals. So the person that I got assigned to, their goal was simply to go to the gym. But because of their mental health conditions, they used to feel very insecure, very paranoid about going to the gym. And, for a normal person, that's just going to be like, oh, you just roll up to a gym and it's fine. But for this individual person, it was the scariest thing ever. And I'll always remember, and again, with volunteering, you'll get training. They won't just throw you in the deep end. So I had to carry out an interview. So they obviously had to see that, I was the right person to, obviously carry out work with a vulnerable person. And from that, I then had training, and from that training, there was supervision. So I had all the support there, because it was still a bit daunting to work with someone who was very vulnerable and at high risk. And again, I've got no experience whatsoever, so it was all very new to me. But again, on the first day when I met this lovely girl, for me it was very easy just to go up, and I'm like, look, I'm here for you, we'll do this. It's your goal, blah blah blah. But we went, and then she's like, everyone's looking at me, and I was like, oh, no one's looking at you. And she's like, no, Habiba, everyone's looking at me. And she got into a panic, and I could just see she was so uncomfortable, and she ran off and left me, and I stood there and I didn't know what to do. And it's that situation where I then was like, okay, let me get her bag, and she left all her belongings there. So I then started sort of chasing after her, and afterwards, she was outside waiting for me, and I could see, and I was like, wow, like, this is something that's so easy for me, but for this individual person, in her head, she's got another whole story. So this is where I then was like, wow, I want to be here for this person, and I'm going to commit to the 3 months that, you know, I've signed up for to help this person with their journey. And, you know, she wanted to go home, which was fine. And, you know, it's about, you know, understanding. And I guess for me, I was like, wow, you know, I got to learn that I'm a very patient person. I was very caring. You know, I was a good listener, because you have to sit there listening to how they're feeling and stuff. So, you know, from that, I did that volunteering for 3 months. And then I was like, wow, I want to see what else there is, you know, available for me. And then from that, that's where my sort of career started. And I got into a role for a charity organisation to become a project manager for an elderly Bangladeshi community. And you know, it was so wonderful. It's the whole element of just, you know, helping someone and making a positive impact in their life. And it's been really lovely from there. And, you know, I've sort of grown my career, and now I'm in the council, you know, and it's just been really, it's been really good. So yeah.
Yeah, thanks to Beaver. And actually, it's interesting, isn't it, that all three of you have started or studied sort of different skills, and then all moved into roles in health and social care. And I think that's quite inspiring. You know, it's never too late, is it, to change your mind. Lauren, coming back to you, this might be a bit of a challenging question, but what one thing do you wish you'd known before you started your job in care?
That is a hard question. I think I would have liked to know how much stress it can sometimes cause, to be honest.
Okay.
Because although it's a really good job to do, you get a lot of stress from it. People are relying on you, and obviously that weight is on your shoulders. So yeah, I would say I'd like to, because to be fair, you have obviously your good days and you have your bad days. Obviously, bad days, you can sometimes come out of there in tears. Obviously, good days, you're there jumping around with half the residents. So yeah, so I would say I'd like to know about the stress sometimes.
And that's very honest. But one of the things you do talk about in your video is how, you know, your job is not just about changing pads and sort of feeding and everything else. Your job, which I think is fascinating, is about making memories. How lovely is that? So are there any sort of particular memories that you'd like to share about some of the fun times you've had? Or inspiring?
Well, I think, yeah. So I would obviously go back to last Christmas. Obviously, families wasn't able to come into the home at that point. I don't think we were even having visits in the pod. I can't really remember particularly. But yeah, so obviously you are their family at that point. The family aren't able to come in. So as one of the residents actually said last week, we had someone come in and speak to one of the residents. We turn into their friends instead of carers. And I would say it would have been a couple of weeks before Christmas, we done this Christmas carol singing. And you had residents with capacity, residents without capacity there, and everyone was involved. It wasn't just the one or two odd people. Everyone, I would say 3/4 of the home was in the lounge that day singing, and some were dancing. So yeah, I would say that's one of the best memories, because everyone was involved, and everyone enjoyed it.
Yeah, that sounds absolutely brilliant. And hopefully, you know, you're going to have lots of lovely Christmas memories again in the not so distant future. Shocking it's coming so soon. We have had a question from one of our student audiences, which is, what's the most difficult part of your job?
I would say last offices is definitely, or building the relationship with a resident, and then obviously them passing away for different reasons. Like I had one back in January pass away, and I think that was one of the hardest ones I had to go through, because I'd built a really good relationship with them for multiple reasons. And yeah, it was one of the toughest things I had to go through within the home. It also, like, that one person showed me how much I can care for a person, and how much of a difference we can make, and how much we need to be able to understand, because it turned out this resident had dementia. And she always used to say to me, I don't have enough money for the kids to have dinner and things like that. And when we went to the funeral, it turned out that she used to feed her kids instead of herself. So you then get to learn more about that person. So that's
Yeah, thank you. And it's interesting, isn't it, that even in our most challenging times, we're still learning stuff. You know, every challenge gives us a learning opportunity. Michael, what's been the biggest challenge in your role, do you think? Oh, take yourself off mute, please. There we go.
Sorry, since the pandemic.
Well, actually, at any point, really. But yeah, the pandemic would have set.
At the moment, we've got a little situation going on. It's been going on for quite some time. Is that everything we have to do goes through public health? So at the moment, we are not literally playing football as such. So we're playing football, but they're not allowed to tackle because of this. Because some of our guys are not had the COVID vaccination and in denial that there is anything going on. So we are still doing the project, and it's a matter of trying to get the people over there because they're seeing football on telly. It's like, oh, they're playing football, but we can't do things like that because we work for the NHS. Everything has to go through public health, and if we have someone get COVID over there, then they'll just shut us down. That's one of the things. And the other thing we through the pandemic is that a lot of people started not turning up because they were worried about getting COVID, and that but now the numbers have picked up, so we're up and running as per usual. But now we put them in bubbles, so like there'll be 8 in one bubble, 8 in another, so they're not mixing. But that's the only problem we've got at the moment.
Okay, and actually, I think the role that you do and the sport that you play, it's all about teamwork. So it's all about keeping everybody energized and enthusiastic and encouraging contributions, even when the chips are down. So I imagine that's a big part of what you do, is motivating the people around you.
It's a matter of keeping them happy, because, a lot of them don't go out, like I said earlier. So what I do on a daily basis is I'll ring them up and say, oh, what you been up to? Are you taking your medication? Why don't you come back to the project? Why don't you do this? And in the end, they do literally come round to your point of view, and they do pop over there, and then they go into a bubble, and then move on to, in the sense that they start turning up regular. It's not a thing that they do have to come. It's like an open door.
Voluntary. Thanks, Michael. Habiba, one of the things you said in your video, and you said at the beginning when we started talking, is how much you love talking, and I found a fellow talker. I'm a big fan myself. How easy or challenging is it to chat to people from so many different backgrounds, the communities that you work in? So they're gonna face different disabilities, they're gonna face different challenges, maybe different languages. How do you manage that?
So when we have a referral from, for example, a social worker, we have a referral form. So we'll get the person who's referring to put as much detail as they can. So we do have a section where we will ask the referrer if there's any sort of, communication difficulties. So the person might be like, they only speak Gujarati, for example. So then I'll take that into consideration. So then when I'm going on a home visit, or at the moment, if I'm doing a sort of, telephone assessment, we'll book in an interpreter. So we will have someone there to translate. So we'll make sure that we accommodate, everyone's sort of communication needs in that sense. Again, sometimes I guess again it's down to experience and to, you know, individual person in terms of, I'll still make sure that I'll try and understand. I mean, I speak so my background is Bangladeshi, so I sort of have picked a bit of sort of Hindi and Urdu, so I'll try and use my own skills to still communicate. So you'll get that throughout. You know, you'll have someone who doesn't speak the language, or who may you know, have speech impairment, or who may have visual impairment, so they can't even see you, and you know, it's all those things you have to factor in. But again, because we work for the council, you know, we've got the chance to have services in place to support us when we're carrying out these needs. And, you know, we want to make sure that everyone is treated equally. So we'll make sure that there's no barriers, and everyone will be able to obviously carry these assessments without having any issues. So we do face those problems, but again, there's a solution to all of this. So it should never be daunting for anyone to worry about, you know, how will I then communicate with this person. So yeah, it's been fine in that sense.
That's brilliant. And again, it probably comes down to a lot to do with teamwork, maybe, and confidence, you know, and just being able to, if you're struggling to do something, asking your team around you how you might tackle a problem or a challenge. So
Yes.
Interesting. I'm conscious of time. We're going to go to a break shortly, so I'd just like to ask you all one more question, if I may, please. Start with you, Lauren. We've got our student audience here today. What is the one bit of advice you could give to them thinking about a career in health and social care, and maybe in your role?
One bit of advice: throw yourself in at the deep end. Absolutely. Don't let anything put you off. As much as there is obviously cons, there's a lot more pros than cons. So definitely throw yourself in the deep end, get involved. Obviously, if you don't understand anything, ask, because that's the most important thing. Yeah.
Yeah, good advice. Thanks, Lauren. Michael, what advice would you give?
As a peer, I would say go, if you get the opportunity, go on the peer training course, which I've done through you guys at one point. Just probably a bit like Lauren, really, just throw yourself in the deep end. You're always going to come across problems, but you'll get more satisfaction than you will problems, and just think of the good more than the bad.
Really. Yeah, lovely. Thank you. And actually, I've got one more for you, Michael. Knowing you're such a massive football fan, who do you think is going to win the World Cup next year?
Next year, hopefully England, but there's too many big players.
We can but hope. Hey, Habiba, what bit of advice, what's your sort of closing words in terms of advice for our student audience, please?
I mean, when we're young, I guess sometimes we get influenced by our family, who will try and sort of, you know, steer us to a particular career. But I think, you know what, be true to yourself, and believe, follow your heart. Definitely, if it's something you're passionate about, you know, in terms of sort of helping people, making a change, then do you know what, follow that heart. And again, I guess I've worked in this field long enough. A lot of people feel that health and social care is a low-paid job. You know, I definitely will disagree with that. I think there's just so many jobs out there, and you know, you work your way up, and that's exactly what I've done. You know, I mean, I was a volunteer, which meant I was being paid nothing, and you know, I've now got a permanent job on a salary. And I think, you know, all those myths about, you know, carers and everyone being paid really low, I think believe in yourself, work hard, and keep going, and I promise you'll have so many other doors open. And look at projects. I always say projects are very special because they're very unique, and there's so many projects available, whether it's in the charity or the local government. You know, it's all there. But I'll definitely say it's the most rewarding job, and we all will care for someone once in our life, and it's just you developing those skills and doing it professionally, and being a role model to other people. So yeah, have that open mind, and I think definitely it'll be worth it.